Welcome back viewers, welcome back to ESD course on sustainable healthcare. In the last class we were discussing about balanced lifestyle, healthy lifestyle, balanced life and balanced diet, nutrition etc. So, to continue with that, then we will go for then next is that next important factor is that physical fitness. After good nutrition, proper nutrition, then the physical fitness, how relevant it is, how important it is for our balanced lifestyle or positive health. So, in order to that means in order to maintain a balanced lifestyle and healthy physical status, we need to engage ourselves. We need to engage ourselves in different kinds of activities. So, instead of leading a very sedentary lifestyle, lousy lifestyle, we should engage ourselves in some kind of physical activity depending on our context. Maybe that if you are working, then in the workplace, or if you are at home, then similarly in the home activities also. So, that means how much active and alert and engaged we should be, and moreover whatever we are doing, it is not that it should not be a botheration for us, like it should not create a kind of stress within us. That means we should do it deliberately, then voluntarily, that means with loving it, enjoying it. So, it is a kind of the physical activity, the engagement that should be meaningful for our life. So, that is engaging ourselves in some sort of physical activities which can give a kind of happiness, satisfaction, a joyful experience, so that it can be converted, it can be directed towards the positive growth. So, that is also the researchers also found it. So, the right amount of physical engagement, that keeping ourselves fit, then stress free and the peaceful mind and the meaningful, leading a meaningful life, relevant life, and getting the value out of this, that is the right kind of approach, positive approach towards our physical fitness. So, a moderate amount of daily physical activity also offers us the benefits, and it also gives us a kind of relief or relaxing mood also. That means mood, so that we can devote to concentrate more on our own personal development, like taking care of our health, then mind, that means devoting time in in the mindful activities, in that means de-stressing ourselves in some kind of pursuing some kind of hobbies, then listening to music. So, automatically it can keep in control all our blood pressure, then heart pressures, blood pressure and heart related any problems, and the back pain, even spondylitis, obesity, all kinds of things. So, all these things will be in control if you can maintain a routine kind of physical activity, daily activity, with the benefits, and the again we should not be overstressed, overburdened with the activity, but it is kind of moderate activity, so that we can get the free time to relax, to pursue our hobbies, to enjoy our life and get the meaning out of it. So, these are some kind of the resources that we can engage ourselves in different kinds of activities, maybe in gardening, in cooking, maybe in listening to music and practicing music, and painting, drawing, all kinds of any kind of hobbies, that, or even reading books also. Reading books also can be very entertaining, very enjoyable experience. So, we must keep some time for our self development, self reflection, self contemplative learning, self pursuing our own hobbies with the moderate kind of physical activity. So, that is very, you can say that is a very kind of healthy lifestyle, in the sense that means we are giving due attention to our mental health, to our physical activity, as well as our spiritual growth also. So, similarly, the physical activity, as we know, physical activity has a significant impact on our mental health. So, in order to recover from any kind of stress, any kind of post traumatic disorder, etc., and to fight back against any disease, like which has incurred us any kind of stress or the bad experience, all kinds of things. So, we have to in order to come back to the normal life and be resilient and to strengthen our immunity system, then we should also follow this kind of proper nutrition and proper physical activity, and it also in the long run also it slows down the aging process, also aging related effects. So, healthy lifestyle, healthy routine, healthy balanced diet, healthy nutrition, physical activity, spiritual growth, then pursuing the hobbies and relaxing and mindfulness activities, meditation, then and taking care of our own personality. Even sometimes what happens is some nurturing certain things, nurturing service orientation, nurturing new kind of hobbies, or nurturing some kind of goals in terms of services, social services, or educating or extending help to other people disadvantaged. That also gives a kind of positive experience and meaningful experience to us. So we must that means after sorting out designing a kind of blueprint or timetable, our own timetable, if you can get some time out of it and spend it with others in service, with a service orientation, with an intention to help them, so it can be very meaningful, and it also gives a kind of meaningful experience to us, which is very relevant, very relevant for our mental health. So, the major cause, most of the important factor that causes our health is that obesity and malnutrition. A section of the population, they are either disadvantaged they belong to disadvantaged community and deprived of proper nutrition, so they are suffering from the malnutrition related diseases. And another section of the population, they are because of their overeating or irregular that means bad food habits. So they fall the victim of obesity. So these are the two important, the most concern areas for health counselors or health consultants. So heart related disease significantly, again definitely it increased the obesity, because of heart related disease emerged because of the obesity, and which is a very prominent cause in the today's world, with the habit of fast food and cold drinks and soft drinks, all kinds of things. And this is the data, that is the data from the UK, which has shown that highest level of obesity in European countries, that is 67% men, 57% women, and an alarming rate of childhood obesity even in UK, and 1 among the 10, that means 1:10 ratio, that the children are obese. That means because of their sedentary lifestyle, because of their bad habits, bad food habits, because of that means their obsessions for fast foods, cold drinks and sweets, and all kinds of oily foods, etc. So because of this, the obesity is one of the emerging health that means health issue, emerging health challenges that we can face, and another is the malnutrition. These are the two, you can say contradictory kind of, but two are crucial challenges that we are facing nowadays. So that is why, for example, we have to maintain a healthy balanced diet chart, the list of chart of balanced diet, that is for the different age groups, starting from the children to teenager to the middle aged people to the old age people. So for different age categories, we must maintain a kind of chart of balanced food with the consumption of different kinds of protein and the different kinds of nutrients, along with the vitamins, etc., as per the percentage level, as per the at par with the age level criteria. So that is how to avoid the unnecessary snacks and sweet and sugars and oil, etc. So because some of the diseases like type 2 diabetes, hypertension, so all kinds of early markers of the heart disease and breathing difficulties and increased risk of fractures and osteoporosis, all kinds of things, even in the some of the psychological effects, in case of the young children, that is because of the not only because of the diet, also bad diet, but also due to the lack of physical exercise, lack of social interaction, social relationship interactions, and the games as well, games. And in this pandemic scenario, most of the, because most of the people, most of the children, most of the young old people, they are confined to their own houses and their, so they felt very much depressed and now cut off from the social activities, etc. But here again, this kind of situation also gives us not only a challenge, but it has also taught us, it has also given us an opportunity to develop the good habits, that is adaptability skill, being resilient, and to pursue new hobbies. That means how to engage ourselves even inside the door, how to engage ourselves in the meaningful work, in the knowledge and skill development, competency development, techno savvy, in the even in the digital platform also, how to engage ourselves in other kinds of home activities and other pursuing other hobbies, reading behavior. So that again it gave us a challenge, not only challenge, and opportunity, and to be innovative, to be creative in thinking and preparing a plan, preparing again the daily routine even during this quarantine or the lockdown period. So that is also, it has also given us an opportunity for the better preparedness for the future. That means all when we are working outside is okay, we have to maintain a work life balance, balanced diet, physical activity, everything. But here staying inside the house, staying inside confined in our own residence and cut off from the social activities and with the social distancing and etc. So how to engage ourselves in a very meaningful and having a very enjoyable experience and learning experiences, that is also a kind of challenge that we have faced, not only faced, but it has given us an opportunity to learn certain new things, develop new skills, new competencies, new mental health strategies. So these things also to be taken care of, especially not only the obesity and malnutrition, but how to stay in isolation, how to engage ourselves. So it is important not only the self engagement, even in the virtual community, in the online community, in the learning community, how we can also share our thoughts and ideas, how can we engage ourselves. It is not that 24 hours we be engaged with our mobile phones, with social networking sites or social networking or the Facebook and YouTube, etc. That is not the justified way, but yes, for relaxation, for communication, for kind, it's okay, but at the same time we can engage ourselves in a better way by learning some new skills, new competencies, new subjects, new knowledge, as well as engaging within, because we have enough of time now. So how to engage ourselves with in a very distributed and meaningful way, that also we have learned out of this situation. So malnutrition, what is the current status as per the WHO 2021 status? So that means malnutrition primarily refers to the deficiencies, excess or imbalances in the nutritional status, energy and nutrition status, then consumption of the poor quality of diet or inadequate diet, or that is the poor consumption of this, or bad food habits, and out of these, so around 1.9 billion adults they worldwide, they are the victim of this kind of diseases, primarily obesity or malnutrition. And so estimated 528 million or 29% women of the reproductive age around world are affected by the anemia, that is poor malnutrition, and which approximately out of which approximately half would be amenable to supplementation, which requires supplemental diets. So this is the data of WHO 2021. So these are the website links. You can go for further discovery of this data. So the current health status in India. So current health status in India, that is yes, COVID-19 is the primary communicable disease, malaria, dengue, HIV, TB. These have been reduced, but still persistent with the national health profile, that is the non-communicable diseases like the cardiovascular diseases, diabetes and the heart related problems. These are the non-communicable but very common features nowadays in the society. Again, cancer almost contributes more than 15% deaths in India. It is expected to cause more than 80% global burden globally by gradually. The WHO says that non-communicable diseases country profiles 2018. So, but now in this pandemic, what are the other mental health issues like the depression, stress and psychosocial, psychophysical kind of imbalances, psychophysical diseases also are the new features, added features in this thing. So, during this COVID-19 or pandemic also we are suffering, we are experiencing also some mental health issues, which are the emerging challenges to the health sector. So, mental illness and disorders primarily during this since 2020, and moreover disability is there, mortality rate also, child mortality and infant mortality rate also is there. So, these are some of the data, these are the state wise data about life expectancy at birth, that is in different states, that it can show. The highest the best data is in Kerala, and the poorest, the lowest data is in the Madhya Pradesh, I think. So, infant mortality rate, what is these things? So, these are some of the data which are available, already available in the internet, in UNESCO portal, WHO portal, as even DP portal also, that we can find out. So, WHO in 2006 defines health as the state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So, as per the definition of sustainable health, similarly WHO has said that the sustainable health or the good health and well-being defines that it is not just the absence of the diseases, but for the complete, you can say, complete physical, mental and social well-being. So, it is not just having the possessing a good right health, good physical health, but healthy lifestyle, healthy physical, that means healthy physical health, positive physical health leading towards the well-being and welfare. Mental health, similarly, the mental health not just possessing the individual mental health or positive mental health, but leading towards the well-being or the long-term outcome or long-term implications, or serving or contributing towards the community well-being. Similarly, the social well-being also, that is social cohesion, interpersonal relationship, being empathetic, being developing positive characteristic strength like caring, then resilience, then caring and sharing with others, care for the society, then taking care of our planet, our environment, ecosystem, having the service orientation, then developing all kinds of the positive values like altruism, gratitude. These are all that comes under the social health. So, how can we enhance our social health? So, not only getting ourselves free from the diseases, all kinds of diseases or sickness or etc., but also how to transform ourselves towards the positive dimensions, that is towards the individual well-being, social well-being as well as the community well-being. So, these are the primary dimensions of health, and how we can move forward towards the community well-being, social well-being, and so that we can move towards the global well-being. So, here you can say we can that in the healthcare model we can find out how the progress, what is the model, that is from the biomedical model given by the Flexner in 1910. From the biomedical model, how we can move towards a sustainable, that is biopsychosocial model, that is both biological, physiological, psychological, social model in 1977 given by the Angel. So, here we can say health and illness, or health fitness or well-being, all these are directly related to biological, means environmental, our physical, biological, genetic, all kind of issues, psychosocial, psychological issues, psychological, emotional issues, as well as the social issues. So, these are the primary domain which affects our health and well-being. So, besides our biological framework, that is the genetic factors. So, there is again health is a continuum. Travis 1972 said that health is a continuum, in the sense it is not like absolute, like yes or no. There is, it's a continuum, it's a slow, it's a progressive. It's a progressive, like from the complete illness, disease and suffering to gradually moving towards the treatment with the good treatment, gradually moving towards the progress and development, and then gradually it moves towards the health, wellness and complete well-being. So, here we can say we map it in a continuum, either starting from with multiple complexities, poor quality of life, to limited body immunity, all kinds of things, functions, to the gradually moving towards the again having the moving towards slow development with even having the poor health and symptoms of some drug therapy, some surgery, etc., then moving towards having a balanced state of physical body and mind, that is with having no symptoms or recovery, or exercises with gradual recovery of health related complexities, and then thereafter then slowly moving towards the good health, regular exercise, good food, nutrition, proactive approaches to life, positive engagement, etc., then come to the optimal health. So, here optimal health is that 100% continuous development, 100% participatory wellness, lifestyle, everything. From optimal health, then we can move towards the sustainable health. Optimum health, that is at present we are good, we are healthy, we are happy, etc. But how to retain that positiveness, how to retain and sustain that health status and positive health, then how to think for the plan for the future, then we can move towards the sustainable health. So, here definitely there is a requirement for the importance of health and education, health related education. So, WHO has emphasized that the importance of health education, health is a fundamental right, so rather it is a fundamental right, and the health and well-being, how these are this can be communicated, this can be this kind of information can be shared and disseminated disseminated in the among the community people through different kinds of workshops, awareness programs, etc. That is how living in harmony with the self, with others, and with the environment. Living peacefully living in harmony with our individual self, with others, and with the environment. How important these things are. How to improve the overall quality of life with balanced food, nutrition, diet, exercise, etc. Then again, how to increase the productivity, our own productivity, individual productivity, community productivity, group productivity, team productivity, social productivity, by engaging ourselves in the positive and the productive activities, engage ourselves in the meaningful activities, so that not only our own development, but the social development, community development takes place. Then basis for attaining the peace and security in the world. If you want to have the peace and justice, the peace prevail in the society, if you want to prepare our society for a peaceful and just society, then these things are, you can say, these are the prerequisites, we can say these are the prerequisites. Only after achieving all these things, then only we can move towards a peaceful and the just society. So, health education, that is the responsibility of both the government to educate and empower the people, even the non-government organizations, social sector, social entrepreneurship sectors, they are also, their job responsibility is to educate people, to serve people, to educate people, to enhance their awareness, so that they become more capable of taking their own responsibility of their own health, their family health, and their community's health responsibility, and engage themselves in a very very careful and caring and empathetic way, so that they themselves can interchange or communicate this message, and convey this message to their fellow members, to their community members, and they themselves can take care of their family members and their community people. So, people also to take the informed and conscious decisions also. Here at the same time, taking the right decision at the right time, that is also very important. Like if you are suffering for some kind of disease, some kind of stress, or some kind of health illness, etc., then we should not waste the time just lingering it, or because of the ignorance or the casualness, but etc., but rather we should contact the immediate primary health center, or the doctors, or maybe some kind of some volunteers from NGO sectors to get the remedy, get the treatment as soon as possible. So, taking the informed and conscious decision at the right time, that is also most important. So, these are some of the health initiatives taken by our government of India, like you can say National Health Profile, National Health Policy introduced in 2020, that is Ayushman Bharat, that is Pradhan Mantri Jan Arogya Yojana, that is under this scheme. There is 1.5 lakh health and wellness centers covering almost 50 crore beneficiaries in the secondary and tertiary level to be achieved by 2022. This is the target. National Digital Health Mission, that is, it's an integrated national database, created nationwide database to make health system evidence based, transparent, efficient, and it can be, so the every individual client can have the access to his health status through these digital health platforms. Then National Health Mission, that is the how to attain the national universal health coverage, that means equal access and access to health care and quality health care, that is the universal health coverage, deliver the quality and affordable health care services to all, that we have already discussed about the quality health care for all across the country, all across the global citizens. So, that is with the affordable cost, they can also get the equal quality of access, equal quality of health services just like others or affluent people. So, it is kinds of equal access to good quality health services as well as with affordable cost, that is how to deliver it, that is under the National Health Mission. Universal health coverage, that means across the country, across the globe, how every single individual, every single person can get the access to quality health services. And again, Central Bureau of Health as a health intelligence is also there, that is for the collection, compilation of analysis of data, disseminating the information. Then you can say the all health related data can be analyzed for for prediction, for future prediction, for future preparedness, for proactive approach, so that any kind of health related disaster can be tackled, can be tackled very efficiently and effectively with the emergence of any kind of risk. So, risk coverage, disaster management with the health issues or the risk, like this kind of pandemics, these are also very important. So, Central Bureau of Health Intelligence, they exclusively work on this health data, health facilities, services provided, then the patient's feedback, everything to strengthen the system, not only the digital system, digital platform, digital health platform, but also the prompt service network of the all kinds of hospitals, health service units, hospitals, the staffs and the training and development, research, all these things kinds of network can be strengthened, can be made. So, now with with this kind of the government schemes and the health innovations and the digital platforms, digital health facilities, now India is gradually slowly becoming a very hotspot, you can say hotspot for the medical tourism. Most of the people, they are visiting India to get the quality health services with the minimum cost, it's very less expensive. So, now this medical tourism is also as the output, is the product of this kind of schemes being initiated by the government. So, up to this now how to make our healthcare infrastructure in India very robust, very strong, very transformative, very transparent, very effective. So, it is the responsibility of all of us. It is not just only the responsibility of the government or the health professionals, but it is the common responsibility, it is our social responsibility of all the citizens of India and all the global citizens. So, now I would like to conclude here only with this much of discussion. So, next then we will look for the other aspects of the ESD. Thank you very much.